I'm Patricia Weltin, and I'm from Rhode Island. I started the Rare Disease United Foundation. We first started in Rhode Island, and now we work globally. Both of my daughters have a rare disease, or rarely diagnosed disease, as we're calling it now. And about 5 years ago, I started to work on, work by state. I just wanted to do one event on Rare Disease Day. And the idea was to instead of doing a Rare Disease Day event by disease, we would do it by geography and location. And, it didn't matter to me what other people's disease was. It mattered what the journey was. So we ended up, the very first event we had was on Rare Disease Day. We had a blizzard, but we still had 150 people drive out. And it was just a great event. There was a lot of stuff for the kids to do. It was a family event. And I kind of put it on the back burner after that. And about a month after that happened, we had a call from U.S. Senator Sheldon Whitehouse asking us to work on federal legislation for the Expert Act, which allows the allows the FDA to bring in rare disease specialists and experts and patient advocates when they're reviewing treatments. So then I started thinking, wow, this is a really good idea, working by state. I should just do this in every state. So we started working on issues by state. We created legislation for a Rare Disease Advisory Council that has been filed in several states. That's kind of taken on a life of its own and passed in I think 3 or 4 of them. So the idea of working by state became important, and it's a way to get things done. So we focused on state issues, and as in many states as we can. We have Facebook groups by state because, if you're in this space and you have a kid with a rare disease, that there's a lot of isolation, but there's also, you don't have to stick with the people in your disease. We all understand, we all get it because it's such an unusual journey. People don't expect to wait years for a diagnosis, and they don't expect there's no treatments when their child gets sick. So we're all in the same journey. So it's a shared journey that we have come to find, is useful to break away from that disease-specific mindset. Most of our programs at Rare Disease United Foundation are focused on things like reducing diagnosis time. We do work on legislation, but reducing diagnosis time, awareness, and education are really, really important to us. The idea to do an art exhibit came from a young girl who approached me and said, can I paint somebody with a rare disease for a school project? And after that, I thought, wow, I wonder if we can put out a call for art here in Rhode Island, and we can, get an exhibit, and maybe the exhibit can travel to medical schools. And so I did put out a call for art, and we had about 17 people respond. So the first exhibit had 17 portraits, and it was at Brown University Medical School in Rhode Island. And a few months later, we ended up going to Harvard Medical, and by then we had 35 portraits, and the exhibit started to just take off. By the time we were right after Harvard, we were approached by CBS Sunday Morning, and they wanted to do a piece on the exhibit. And when they started working on it, we'd only been to 2 venues. And now, 2 years later, this Rare Disease Day, which is coming up, we will be at 7 venues. We're going to be at the NIH, which we were last year. We'll be at the Broad Institute, which in all of these things, like at the Broad Institute, there will be a symposium surrounding rare diseases. All of these things, where the exhibit goes, generally, there's some kind of educational program to go with it, which is more than we ever hoped for this exhibit. We just hope to spark some interest from students, but it has become so much more than that. So we're also at the FDA this year, which I think it would be beneficial for the FDA to see these kids. We're going to Children's of Alabama, Children's of Texas, and we're going to Quinnipiac. So we're pretty excited. And the only limitation that we have here right now is it's certainly not demand. It is supply. We could have been at many more venues. We just do not have the supply right now. We're about up to 100 portraits. So after, Rare Disease Day winds down, we're going to start. We do have more artists. We do have more patients that want to participate. So we're going to start matching the artists and start a new process of creating artwork. Right now, we are representing about 100 different rare diseases. The idea is that, eventually we get to 7,000 portraits, and there's a face for every disease. That's what we hope to do. It's really, really ambitious, but I can't believe how far that we've come in the past 2 years. So it's interesting. It's an interesting process, but right now we're also trying to make it go global. So we're working with organizations around the world because it's a global issue. And the art exhibit has been an extraordinary and successful way to engage people that otherwise would not have been engaged, not just the medical community. I've had people contact me that want to volunteer for RDUF that have nothing to do with rare diseases. They just happen to see the CBS piece, and now they can connect to us. And it's hard to connect to rare diseases because, even when you just hear rare diseases, you think uncommon. The general public doesn't become engaged. They don't know the story of rare diseases. They don't know how long it takes. They don't know we don't have treatments. They don't know that there are children that are suffering and dying, and they don't know how many millions of people are affected. Personally, I've recently become very, very interested in some research that's come out for my daughter's disease, which is fantastic because there really hasn't been a lot going on. It means everything. This is what we need. But we're starting at the bottom. We need awareness first. We need people to know we exist before they decide, let's start researching this. The interest in rare disease treatments is not old. Even though the Orphan Drug Act has been around for 35 years, the interest in rare diseases and the amount of treatments that have come out about rare diseases is relatively new. And I think that has a lot of things to do with that. 35 years ago, we couldn't map the human genome. So we didn't know. So there wasn't a lot of research going on for these genetic diseases, especially these rare genetic diseases. So now we get the mapping of the human genome, and then, it was $100,000 to get somebody sequenced. Well, now it's a lot cheaper. I'm Patricia Weltin, and I am aware that I am rare.